Thank you. So how are you doing, Larry? Great. Good. So what? Very good. Very good.
So you have Larry and the lovely
this is
Charmaine
here. And then Larry has had some Botox in the past. As I said, this is just going to be a top-up. But what I want to... I'm sorry. We're going to work on his frown areas again. And frown for me. Just angry. Angry. So you can see he doesn't have much action, but he just wants even a little less action than that. And we're going to put about 13 or 15 units on each side. And then if you see, move your forehead up. See how this eyebrow really lifts up a lot, almost like what we call it a Spock eyebrow? Well, what's happened is that there has been Botox action up to here, but not in this area, and not in this area. So this muscle is actually pulling harder on here. On this side, you can actually see a wrinkle in here. So we're going to put some more Botox in this area to relax this. And it's not an attractive thing for men to have a high riding eyebrow. It's more of a feminine thing. So we're going to soften that up a little bit more.
So now, Larry's going to look a little more macho, is what you're saying.
Pardon me?
Larry's going to look a little more macho after all
macho.
this.
Well, you cannot. You got to check out her muscles. You don't want to mess around with her. So, anyways, so we're going to work on the crow's feet again. Most of it is gone, but there's some little residual action right over here. And squint for me. And maybe a little residual here, which we're going to just add and top up. And lastly, Larry's got a very good dimple here. Can you? Yeah, you can see all these little dimples. Maybe from the side, the camera can pick it up. Now do that for me again. You can see all these surface dimples. It's great for Botox. Okay? Good. So let's go ahead. Any questions?
I have a question, Dr. Adibfar. I'm wondering, what percentage of men are you seeing in your practice these days?
In my practice, about, as far as the Botox clientele, about 5 to 7% of them are men, and the rest are female. However, it's gradually rising.
Yeah, it seems like it's becoming much more acceptable for men to have these procedures. And one of the doctors yesterday mentioned that one of his clients was a salesman, and he was actually finding that he wasn't selling as much because he had that stern, angry... angry worry line.
Yes. Now remember, I used 15 units for Kathleen.
Yes.
Well, I'm using 15 units for Larry, and meanwhile Larry has got very little action in the muscle. But just puts things in perspective, he's got a much, much stronger muscle. If Larry came to me, I would have probably put about 20 to 25 units on each side. He's got a very strong muscle. So this 15 is just a top-up for him, whereas for Kathleen, it was just a regular dosage.
Because he's already had some Botox previously.
Now put your head back. Can the camera pick it up? Okay, frown for me. Frown. You can see the action is all the way from there to there. Okay, frown and relax. Frown, relax.
Here's your chance to see Dr. Adibfar doing a procedure on a male patient. If you're a male considering Botox or Restylane,
frown for me.
Here's your chance to see it in action. You can also talk with Dr. Adibfar right next door at our Cosmetic Consultation Center, a wonderful service being offered here at the New You Show. So if you have any questions, he's here to answer.
Relax. Men in general have larger pore sizes, so it makes my life easier.
Oh, it's easier to inject in the male pores, of course.
And they don't feel the pinch. Okay, the other...
You know, women have to go through so much pain to be beautiful. Now men are going to understand what it's like.
Right, Charmaine? Yeah, there you go.
Charmaine knows what I'm talking about.
Frown for me. Incidentally, some of these wrinkles are caused by Charmaine, so...
Charmaine is Larry's wife.
Okay, frown for me. Good. Relax. There's 5 right there. Frown for me. Turn this way. Frown, relax. There's a nice pore right there. 5 right there. Some people get headaches right after. Frown for me. For about a week after the procedure, some people say that it actually improves their headaches. Majority of time it improves your headaches if you actually have muscular origin headaches.
Because for years it's been used to treat migraines, is that correct, Botox?
Yes.
So
can you put pressure there?
That would make sense.
Perfect. So we've done the frown muscle.
That was quick.
Now let's just do a little fine-tuning of his forehead muscle. And okay, you can have that. Now move your eyebrows up and see right there. I don't like that, so we're going to move it up again. But just 1 unit. We don't want to overdo this. If you overdo it, it's very hard to get the eyebrow back up. Charmaine, can you come up with some pressure here? Eyebrow back up again. Okay. Looks like Larry knows somebody on the stage. Okay, now move your eyebrow up. And one right there. You can see that. Turn this way. Good. Do it again. Relax.
I'm just going to do-si-do over here.
One over there, and then move your forehead up. And just basically, can you see how he's got a few more foreheads on wrinkles on this side than that side? So we're going to put probably 3 over here and just 1 or 2 over there, okay? Botox works in a diameter of about 1 centimeter to even 1.5 centimeter of where it has been injected. Okay, move it up. In fact, I think I'll just put it on that side. Oh, let's put 1 here.
I started to say earlier that it must be a very creative process for you. Every face is a new canvas. Everyone has different ways of expressing themselves.
Exactly. And, I mean, it's like I've never cut somebody's hair, but I would imagine the first time they're much more gentle and much more cautious about it. But once they get to know you, once they get to know your hair, your personality, they can become more creative with it.
Absolutely.
Okay. Okay, so let's work on the squint muscles here, turn to the left. And again, this is really a surgical case here, but we're going to just try to see if we can achieve some more with Botox. Squint for me. Relax. And again, remember, I'm almost putting the same dosage as Kathleen in Larry. However, this is just a top-up for Larry. So commonly men in here may start with 20, 25 units. This is just in women usually it's 12 to 14 units. Okay, we're done with this side. And 2 more, and that's it. Any questions? Turn to the right.
Any questions from the audience?
Squint for me.
We're wrapping up our second demonstration.
Squint. Relax. Okay. Squint. Relax. You can actually see a little 2 blood vessels there, so we're going to try to stay away from those.
This is clearly a relationship that requires a lot of trust.
Squint for me? That's correct.
What should people ask a physician or someone doing Botox or Restylane the first time they meet that person? What kind of questions should a patient be asking to make sure that they're in good hands?
First of all, ask any question you can ask about Botox, what it is, how does it work, how long does it last, all the things that we covered. Secondly, obviously I guess people want to know about the price as well. Secondly, you want to see whether the doctor actually feels comfortable doing it or not. I mean, as you can see, I can teach anybody to do this, but whether you know the physiology and the anatomy of the muscles very well, whether you know how to fine-tune the muscles, that's the expertise of the doctor. I think you should ask directed questions to try to get that kind of an answer out of your doctor and see whether you feel comfortable with them. And the beauty of Botox is, I mean, worst case scenario, it's temporary. Its effects are temporary. So if you don't like it, you don't have to do it again. It'll wear off after 2 or 3 months. But I've never seen anybody that said that they didn't like Botox.
We've heard that a lot today and last night.
And can you try to show me your dimples in that area? Okay, very good. Do it again. Do it again. Good. Keep it right there. Keep it right there. Right there. 5 and 5. And this is the first time I work on Larry. That's why I'm staying on the low side as far as the dosages. Once I get to know him better, I can add up on my dosages a little bit. So that's it. We're done here, and we did the just a little touch-up. This is a touch-up case on the forehead just to tune things up. Some of those little high-pulling eyebrows, we fixed that up. Touched up the crow's feet a little bit, and for the first time did some of the dimpling of the chin. Any questions?
Yes, sir.
What's the future of the pricing of Botox? Now that it's become pretty common, is the price going to go down? It just seems to be pretty steady at the moment in terms of a regular session.
Now that Botox is becoming more common, do you think the price will go down or will it remain where it is?
I'm a doctor, not an economist. Sorry. I can't tell, just joking. I really don't know. I mean, I guess it's if you apply the laws of supply and demand, as we apply in any other business in economy, it should apply to that. But then there's more and more doctors doing it. It should. But then, you know what? I can also ask the same questions to the Botox company. The price of the actual bottle of Botox is not gone down. It's actually stable. So It's a very difficult task to create this much Botox. This is a very concentrated product, and Botox is a product created by bacteria, and it's a very difficult process to actually. I think there's a shortage of Botox around the world. That's the last thing I heard. There's only one company, Botox, that it's a reliable company that I would use. There are other side companies that are trying to come up with comparable products, but this specific strand that comes from this specific bacteria is the one that's created by this company. And there are going back to the price issue. There are other companies that are trying to sell you Botox that's much cheaper. Unfortunately, to me, the most important thing is patient safety.
Great question. Thank you so much. And thank you, Dr. Adibfar.
Thank you.
We've run out
Thanks
of time.
a lot.
Thank you so much.
Good.
And again, he'll be right next door at the Cosmetic Consultation Center.
Thank you.
So please take that opportunity to speak with him about any concerns you have.
Thank you. Thanks.